Good morning, everybody. This is Crystal Eshelman, and I'm the project coordinator for the Fully Integrated Medicaid Contracting Advisory Committee. Thank you all for joining this meeting today. It sounds like there is a little bit of background or echoing there, so just a reminder to everybody to put your phone on mute if you're not speaking at the time. Here from the ACH, we have John Chapman, Teresa Davis, Caroline and R.S. Duval. And we have about 27 people on the line, and most people have names written in. So I'm going to start with reading the names that are showing up in our meeting, and then ask for those whose names don't get mentioned to introduce themselves, just because it's sometimes difficult to introduce over the phone. So the names that we have are Amanda Rosales, Amber Bryant, Rena Carlson, Cindy Button, Clarice Nelson, Krista Concannon, Donnie, Ellen Blandon, Ina Liu, Isabel Jones, Kevin Abel, Kim Fricky, Christy Hills, Lena Mitchell, Laurel Turner, Julie Rickard, Roseanne Martinez, Ruth Bush, Shirley Wilbur, Tammy Fall, Tim Hoekstra, Tracy Crowder, Victoria Lafram-Wise, and Samantha Zimmerman. So if I didn't just call your name, if you guys that are on the line introduce yourself, that would be great.
This is Whitney Howard from Molina and Megan Gillis from Molina.
Alicia McCrae with the Housing Authority.
Angela Mello, ABHS. We have a room here at the Healthcare Authority with Michelle Alger,
Ethan Leon,
Paula Larson Sandos,
Jason Bergman.
Hi, this is Kathleen Boyle with AmeriGroup.
Is there anybody else out there that hasn't gotten their name called or introduced themselves?
Gail Goodwin and Darla Boothman from Grant Integrated.
Great.
Hi, this is Roseanne Martinez from Children's Home Society of Washington.
Thank you. Okay. So we'll go ahead and get started. First, I just wanted to take the opportunity at the beginning to thank everybody that's been participating in these fully integrated Medicaid contracting advisory committee meetings and all the work groups. We've had quite a few meetings throughout this year, and it's been really successful to get all this work going. And I'm hoping that it's putting our region in a good place for the transition on January 1st. And so today we have basically final updates. This is going to be, it's the last scheduled FIMC Advisory Committee meeting. And so we have some final updates from each of the NCOs and the ASO. We have a final update from the BHO on their closeout plan from Tamara and Parkside. XPO, who is the IT contractor for technical assistance for the behavioral health providers, is giving an update. We're going to talk about the plans for the early warning system that's going to happen starting January 1st, and the consumer engagement work group. And then lastly, we have some final information coming from HCA on the client transitional plans and assigning the MCOs to the clients and how they can change plans if they need to. And just a reminder, nobody is on mute, so everybody's able to talk if they have questions, and to keep yourself on mute if you're not talking, to minimize background noise. So we will start with an update from Beacon from Ina.
Hi, good morning. Okay, so a couple updates. I think most prominently on my mind right now is hiring and staffing our local team in the North Central region. So I've been interviewing actually for several months and haven't filled the positions. We're hiring for 2 positions, a care manager and a community engagement coordinator. So that is my highest priority, is to fill those positions. On the provider end, providers have been going through credentialing and are doing site visits, and then we are finalizing codes and contracts so we can do claims testing. And then I think this week and next week we have some webinars that some of our providers are attending to learn system setup. And then we're planning to do site visits in mid-December just to make sure all of our providers are kind of set up and ready to go, and codes, and just kind of walk through some final details with everyone in person. And then with our crisis providers, for a couple months now, we've had an every other week call to learn about crisis systems and talk about the transition plans. And so we've done demos of the protocol system and introduced the protocol team. And what we're currently working on right now is finalizing the protocol procedure sets for the crisis line to know when to hand off callers to the local crisis teams. And then we've also been talking about the crisis system data collection, which includes the early warning system data points, daily clinical information from the crisis teams, and then information for the data dashboards that we'd like to develop for the North Central region. So I'd say that's the lowest priority of the 3 data sets that we're looking at. And then in the new year, when we go live, we will host daily calls with the crisis teams and the MCOs just to make sure things are moving as we intended and to be able to troubleshoot and problem solve any things pretty quickly. And then as things smooth out over time, we'll reduce those calls. But that is something that we're planning to do. And kind of just some other internal items that we're working on. We are updating our website to include North Central information. We're setting up file exchanges with the managed care plans for eligibility files and setting up processes for PACT and WISE client alerts to put into the protocol system. And then protocol has also done, we're also working with protocol to prepare them for going live. They've done a couple demos of their system and various meetings to introduce them into the community and just to show kind of what their system capabilities are and some of the plans for reporting out of the calls that come into North Central. I think those are my updates.
Great, thank you so much, Ina, for that. Does anybody have any questions for Ina? No? All right, then we'll move on to an update from AmeriGroup. And give me just a second and I'll get the slideshow up for you.
I may have put more detail in this than anybody wanted, so.
That's okay. So just go ahead and tell me when to go to the next slide and I will.
Sure, so go ahead and jump to the next slide. Hi again, this is Kathleen Boyle. I'm the Director of Behavioral Health for AmeriGroup. I'm also the lead for implementation and everybody's primary contact around implementation central. This slide is from all of us presented earlier this year, and so a couple of these slides are just repeats of what we originally presented. This is a list of our implementation team that have been part and parcel to all of the implementation efforts. And if you want to go ahead and jump to the next slide. With our implementation team, we've also added several folks, including people from our HR department here in Washington, our regulatory department, and then many of you may have spoken to someone by the name of Ellen Blandon, who we've added as a project manager quite a while ago and is overseeing a good and helping me out a good portion with the implementation. But if there are additional questions and everything, here again is my contact information regarding implementation, both now and after we go live here in January. Some of the kind of pieces around that, just for the group to know, Crystal had asked for kind of highlights or things that have occurred. So I can tell you that we have been boots on the ground personally. Myself, I've been there pretty much every week since June. I think there's only 2 weeks where I haven't actually been in the region for at least one day. Usually I'm there kind of Sunday through Thursday. We're going to continue to oversee that piece. I will be out in the region in addition to several folks that we've hired in the region, and I'll talk a little bit about that in a second, but we're going to continue to, I'll continue to be involved with implementation all the way through spring of 2018 or as needed or as identified by this group, by providers, by community stakeholders, and also by our members we'll continue to be in the region from our Seattle office all the way through past January 1st. So if we want to go to the next slide, so a couple things to highlight, changes that have occurred, and I think each of us will speak to this. So our office in Wenatchee is now open, technically. I have it in quotations because we have the space, we have the furniture is all set up, and all of the equipment is there. I will be out there next week to actually officially get it open, but it is there and functional in Wenatchee. We're located in the Morris building downtown, and so at some point we'll be having an open house and inviting folks to come out and see our space. We are also all finalizing our co-location office in Moses Lake. Will be co-located with Grant Integrated, and that will be in place by 1/1. And Grant has been great working with to get that up in place. Some of the other pieces, we've successfully hired multiple local team members. Some have already started. So an example, we have a new BH clinical director by the name of Julian Thompson. He comes to us care of Swedish Hospital. He's a licensed social worker and has a great deal of experience. We're very excited. So he started here in November. We've also been able to acquire several staff from the BHO that will be starting January 1st, but we're very excited to have them on board and to make a really smooth transition for a lot of the providers in the region, because they'll have some of the similar go-to people and some of the local expertise will be coming on. We've also acquired new behavioral health and SUD case managers in the region, and both of them will be starting mid-December. So we're very excited about that. I think this is kind of a win for all of us, that we've, the MCOs and Beacon successfully aligned processes as we all committed to doing, including the provider symposium that we did together in October, which included training on clinical and operational. Many people were present for that. And as of yesterday afternoon, we are beginning the encounter testing. As Beacon said, credentialing is either completed with all the providers or almost complete with each of the providers. We're moving into and working with XPO to do claims and encounter testing. And then there will be similar, we'll be doing site visits in December. We've been out visiting with providers, but we'll be out meeting with providers throughout December to make sure that they have everything that they need and that things are in place and ready to go live January 1st. If we want to move on to the next slide. So again, we're going to be continuing to do community outreach. We'll be doing, as I said, site visits and coming out and meeting individually with providers. One of the highlights is we're bringing out our national call center that maybe isn't as familiar with the region. They're actually going to be on site in the region. They're going to take a nice tour of the region Monday, Tuesday, and half a Wednesday next week. So they will be learning all about the region so that when they're answering the phone, they know who they're talking to, just like we've been doing with our local staff here. We're going to continue to work with HCA to review and address any gaps that come up. We're going to continue to work with this group to further our goals in the region around integrated care. And obviously, we're going to continue to work with Okanagan County to prepare them as they join North Central. And those are all things that we committed to this group back in this late spring, early summer, and we're going to continue to do each of those things. Another kind of highlight and piece that's coming up around that is that our CEO is going to be coming out to the region to do site visits as well, separate from implementation with providers mid-December, again, to make sure that I'm doing my job and our team has all their ducks in a row and doing everything. So that is a quick, very brief overview of what we've been doing. Are there any questions?
Doesn't sound like it. Nobody has questions for Kathleen or AmeriGroup? Okay. So the next update that we have is from Coordinated Care.
Hi, good morning, everyone. This is Ruth Bush. I'm the Director of Behavioral Health Integration for Coordinated Care. And again, just want to give a very high-level overview, some of the same themes you'll probably hear throughout all of our presentations. But we are, one of our main focuses right now is continuing to be hiring of local staff. We have made significant progress, but there are still a few positions that we are looking to fill. One that I do want to specifically point out that has been filled, Winnie Adams, who most of you know, and I know that most of you are aware of her hire, is going to be really our senior most person within the North Central region that will be local. And she's going to be our senior manager of case management and has been hired and is going through that onboarding process and will be supporting the entire team in that North Central region. Our office is currently being renovated and worked on to be ready to go by January 1st. So that is underway and in the works. We are also continuing to work with providers around implementation setup, including claims and counter testing. We are up and running, doing that with a couple of the providers, and of course a few that are just still doing work with their internal EHR and are not ready yet. But with those, we're working with XPO and HCA to answer any questions that come up so that everyone can be ready for January 1st. We've had our internal start of what we're calling our IMC Training Institute internally, so that all staff within the health plan are trained on the new contract requirements and the individual and unique things about the North Central region. We want to make sure that they understand the system of care, the providers that, and referral patterns within the North Central region and beyond. So that has been happening over the last couple of weeks and will continue into the middle of December, where we're having every staff member trained on integrated managed care. We're working closely with Beacon to finalize that contract and to do all of our encounter and enrollment file testing to make sure that that is up and running. And as Ina said, we're looking forward to having those daily crisis touch point calls to make sure that that system is working smoothly. We're also creating some member communications to our current members to make sure that they understand what is and isn't changing for them, so that'll be going out as a little bit of a piece in conjunction with all of the HCA communications that I think are on the agenda to talk about a little bit later. But yeah, those are my high-level updates, and happy to take any questions or any comments.
No questions for Coordinated Care, Ruth?
Thank you.
Thank you, Ruth. Okay, so the last update from the MCOs we have is Molina. And Whitney or Megan, your slides should be showing now, and I'll go ahead and move them forward whenever you need them to.
Great, thank you. Good morning, everybody. I have a little bit to share with you. We have, basically what I've done is, if you just want to go ahead and move it to the next slide, thank you. I've just categorized some of what we've already completed. A lot of what's already been shared we'll be covering in terms of staffing and so forth, and the boots on the ground, and this last month making sure that the providers have what they need from us. All of that will be occurring for Molina too. I focused the PowerPoint just on specifically on just some of the internal work that we think that people want to know that's been completed or on target to complete or that's work in progress. So I've kind of bucketed into 3 different categories. So this first slide is on our completed implementation items. So all the providers have been credentialed. We had our symposiums, and we have the system configuration completed for all of our contracts. All of our healthcare services teams are ready and hired for January 1, 18 that was just announced in our internal huddle that we had on Monday. So that was really exciting update from our healthcare services team. Our payment plans are in place for mental health services, and we have our contingency plans in place for SUD services for, you know, when we have to ensure the funds are flowing to the providers in the event that there's some operational glitch through, you know, with standard processes. We found that we definitely needed it in Southwest Washington. I think we feel more confident and have done things different, and hopefully we won't need it, but we do have those contingency plans in place and how that will work for North Central. We have our internal weekly meetings established for North Central readiness and also for the ongoing operational opportunities. So we've kind of built that into our system because we treat them as very separate from Southwest Washington. So we've gotten that in place. And then we also have, and I don't know, I have to give the disclaimer, I'm not sure if the email went out today, but it will be going out if it hasn't already from my admin. But we have identified the time and when we're going to be having our weekly provider meetings to support pre and post go live. I believe they're going to be on Thursday mornings at 10 o'clock, but you'll get an email with detailed information and also instructions of kind of to forward it to anybody else within the provider's organization that they will want to add, and the things that we plan to cover and so forth, so you know who you might want to identify to attend those meetings. And okay, and sorry, do you want to change slides now? Thank you. So on track for completion, we have our claims and encounter testing. We have a provider that's about ready for testing and will support others as they are ready. For the billing companion guide, we have our draft completed, and we have to have a review committee. They have to approve it before we release, and we expect to be able to just distribute that by December 8th. So, and then in terms of finance, we have our invoice training and all of our EFT forms to make sure are completed with each of the providers. And I just called out that there's two different forms because our EFT process for claims is different than finance. So it's actually two different processes that have to be completed with providers. So we've got people working on that and ensuring which provider needs what, and that all of that is rolled out to the providers by the 15th of this month of December. The next category on the on track for completion is the amendments. So we've had to do a few updated amendments with providers. One, to add a few SUD services to make our contracts work for all the services and to be supported by what the BHO had supported. And we have our Beacon amendment will be released today. So we've finalized all the terms, and now we're just releasing for signature. And then we have our new provider orientations. All of our providers that were contacted for what our external rep and some operational folks to kind of do a follow-up from the symposium to, you know, either add their own agenda items or also go over things that we want to cover as either a new provider in our network or just some updated information about Molina or information on our e-portal, things like that to help them in the transition. And if you can move the slide one more time. Thank you. And so the work we have to complete is we believe that the MOU with Eastern State Hospital is near completion. We've got some internal review and checks and balances going on that right now. For quality reporting, we are collaborating with XPO, and also we're still identifying what data will be used to report on each measure. So we hope to have that done in the very near term. I don't have a specific date, but it is being worked on. And we also have a provider executive dashboard that we've created so that we did this in Southwest Washington, and we will roll it out to North Central too. And it basically gives at a high level, executive level, an idea of what their experience is with Molina in terms of volume of claims in, or volume of, you know, their volume with us, how much money they've received from us, their denial rates, you know, different things like that, so they can have a high-level picture of, you know, to bring any type of concerns. We'll be, obviously, as part of the early warning system, we'll be looking at all of this and being proactive, but it's just something on a regular cadence to give them, so they can see from a financial perspective what their experience is with Molina. And then for the early warning system, we're confirming that the draft, we're having an internal meeting to confirm that the draft that's been put together is what the requirements that were put together as part of the early warning system group. And then we plan to submit that to HCA for review by December 8th at the latest. We hope that we get it there sooner, but it won't be any later than the 8th. And then there's a communication that we plan to release prior to go live, which will be an email to all the providers with all of the current contact information. It'll have clinical staff, operations staff, contracting staff, et cetera, and any material that we need to share to support the smooth transition. And that is my update. Does anybody have any questions about where we are with our, I guess, our pre-go live final report out, even though we still feel like we have a lot of work to do and a lot of communication to continue to have with all of you providers to make sure this goes smoothly. Last report out, but not last time you'll hear from us.
No questions. Well, I just want to thank each of the MCOs for doing these updates. It's obvious that there's a lot of work going on your end, and there's a lot of work that each of the behavioral health providers is doing to get ready for this.
And Crystal, this is Kathleen. I apologize. I have to be in another meeting. We do have Ellen Blandon on the phone, has been awesome in helping with the implementation. So if there is questions for AmeriGroup, she can either answer them or get them back to me, but I have to race back to another conflicting meeting.
Okay, thank you very much.
Thank you. Thanks, Ellen.
So the next item on the agenda is the BHO closeout plan and Parkside. Tamara, are you and Angela on the line?
I'm on. I'm here.
Great. I'll hand it over to you guys.
Do you want to start with Parkside, or do you want to start with the closeout?
Are you asking me?
Yeah.
It doesn't matter.
Okay, so on the closeout, we're obviously completing almost all the things that are happening on personnel side, having to do the final evaluations and go over the guidelines for the retention packages, inventorying the final stuff that's going to be in our office, what needs to stay past January, all the contracts that need to be terminated and the leases, etc. The financial activities, most of those have been taken care of except for Parkside, and some are outstanding bills past January will continue, and Karen and I will be reviewing those. Trying to think. Our contracts and agreements, we've already sent out a notification that all of them will be cease to be an active contract as of December 29th. And then the clinical and stuff, we're still working on some outstanding questions with the Healthcare Authority regarding just multiple things that have been coming up that I think we hadn't quite identified who would be handling after the close of the BHO. The whole plan. Hold on. Well, pretty much almost everything's completed except for the archiving of all of our records, which is going to take probably the whole month to go through, and having the board decide if they want to have Douglas County maintain certain documents or if they want them shredded after the appropriate time, and then obviously sending the ones that need to be archived permanently to Olympia, and then continuing to work on data submission and reporting after January will happen as well. Audits and monitoring, we're doing our final audits this week, and one more meeting for governing board, one more meeting for clinical and management team, and then we'll be finally closed out. So that's where that is. Does anyone have any questions on the closeout plan? and then with Parkside is moving along smoothly. We haven't ran into too many unexpected glitches. I will be sending an email just on clarification regarding needing to have 2 separate operators for crisis stabilization and the adult residential treatment. There seems to be some confusion with the Healthcare Authority and DBHR on what that actually means. We've been told since day one from the Department of Health that one operator can do both the way the facility is set up. So that email will be going out today, I hope. And construction should be completed by April 1st. And it seems to be going really smooth. And I know Angela can give you more of an update as well.
So kind of where we're at, we're with Tamara, and we're trying to figure out the non-IMD provisions of the program, and so we're aligning to try to make sure those things get figured out so we don't end up in hot water when we open. I'm actually working on creating postings for program manager for the facility, you know, so we could start a lot of work with collaboration within the community, starting to work on purchasing and setting up the amenities within the facility. I'm working on the operational plan. There's some training that I'm trying to get down in California to look at some evidence-based models to continue designing the program. So I think that we're actually in a really good spot to actually start with our implementation as soon as we have our non-IMD questions answered. That's kind of where we're at. Anybody have any questions?
Are there any questions for either the BHO or Parkside? Okay. Thank you, Tamara and Angela, for that update. Sounds like things are moving along. Next up, we have an update from XPO from Tracy Crowder. I'll go ahead and give it over to you, Tracy. Thanks.
Okay. So our primary role has been to provide technical assistance to the providers as they are configuring their systems to be able to submit claims to the MCOs. And so we've been involved in gathering information on requirements and codes, claims setup, reporting, and I know that I've been bordering on harassment with all the check-ins and emails and questions. So I thank everybody for your patience around that. But we've just been trying to clarify what's needed so that we don't run into any barriers and ensure successful claims in January. So we know that 2 of the providers are implementing new EHR systems, and we've been involved with those providers in that implementation. So in that process, we're helping to make sure they configure the systems with what they need relating to what codes to send and setting up their 837 claims transactions. The other 3 providers are either ready to test claims now, or they certainly will be ready to do testing in December. And everybody seems to be on track for the January go live. I think the biggest thing for us is if there is anything else that's needed to make sure providers are ready for claim submission in January. So if there's still information that's needed that we can help gather, we're more than happy to do that. If providers that are on the call, if there's anything else that you know we can help with, we want to do that. I think the biggest question that I wanted to make sure we understood is if there's anything beyond what you already have relating to credentialing or registering. Some of the questions we've received relate to if providers have registered and credentialed staff through one health port, if that's enough, or do they need to do separate steps with each of the MCOs? It sounded like some of you already have what you need for credentialing and it's done, but I just want to make sure if there's still some confusion or other information that you need to let us know if there's stuff we can help with. Otherwise, we're just going to proceed with getting providers set up for testing. I know if the providers, there are some that are already submitting claims and being paid by some of the MCOs, and we were told that testing isn't necessary if that's happening already, but they still have the ability to test to make sure that their new codes or different scenarios go through okay. But if there's any other information that we can gather relating to credentialing or registering, just let us know that. But it looks like everything's on track to complete the testing in December and then be ready for January. So again, I appreciate everybody's patience as I've been bugging you for information. Thank you. Are there any questions for XPO?
Anything from any of the providers or MCOs on the line for XPO? No.
Okay, thank you.
Thank you, Tracy. So next up, we're just going to give a little bit of an update on where the early warning system is at. It's a couple months ago, the NCACH governing board approved the recommended indicators that we had talked about at this meeting. So we have those, and then so we're first going to start with Krista giving an update on the data collection planning. What I'm showing on the screen is a very small version of the early warning system indicators that we approved. And so I'll go ahead and hand it over to you, Krista.
Hi, this is Krista. So I am working with everyone you've heard today already on collecting the data. We will be providing baseline data for these measures where it's possible. And then we will start reporting in January. Some of the metrics, as you can see, are monthly and some are bi-weekly. So by mid-January, we should have data ready to share. I appreciate everyone's effort in working with me. And we're standardizing the template. It's a little difficult, tricky. We're, basically getting templates ready for data that doesn't exist yet, but everyone's putting in a good effort. So if there's any questions on anything, I can answer those. Otherwise, everything is coming along pretty well.
So Krista at HCA has been our contact with the AIM team to collect this data and do the analysis of it, and then a part of the early warning system will be getting that data back to the early warning system work group to analyze at monthly monitoring meetings. And so basically all these indicators that are on the screen will be looked at regular intervals, and if there are any like spikes that are concerning, we can dig into it more and look for any kind of problems or how we can resolve those issues. So what is showing on the screen is just kind of an outline of what these early warning system monitoring meetings and daily provider calls. Alice is going to talk about the provider calls in a minute, but on the lower left it says early warning system monitoring meetings, and so these will be monthly, and that's kind of the group of people that we want to be a part of these meetings to identify any problems and look at the data. And there'll probably be webinars so we can show the data, but it won't need to be necessarily in person. And then we'll go from there. And so Alice, if you're on the line, do you want to talk about the daily and biweekly calls?
Sure. So this was a process that worked really well for us when we implemented in Southwest, was to just have a daily call from the very beginning of implementation that would allow providers to have a direct line of communication with the MCOs and vice versa, and then to be able to have other folks available to the call. For example, Beacon will be on those calls, and folks from the Accountable Community of Health, so that if specific issues come up and people need responses right away, that they will have someone available to answer those immediate questions or to deal with immediate concerns. It's always an awkward thing to start off a brand new program like this or a big change to clients on a holiday when the state office buildings are closed. We will have that very first call on the 1st of January, despite it being a holiday. And it's really to make sure that nothing kind of fell through the cracks over the weekend, because of course leading up to the 1st is also a holiday weekend, and we know that people might have been admitted to service over the weekend or have had crises over the weekend. And so these aren't obviously because we have multiple people who don't have who don't have the right to see confidential information. We're not going to be talking specific individual cases, but it's a way to say, I'm working in the emergency room. I saw a person who had such and such enrollment with a health plan. I need to reach out to a health plan person to find out what should happen with this person now that it's Monday. And then they would have access to the managed care plan person who would be able to say, let me problem solve that for you. So not that we would be talking cases on the phone, we'll be talking more at a high level, but just to make sure to open the lines of communication. So in Southwest, those daily calls gradually and with pretty little effort on our part, gradually went from a half an hour a day to 15 minutes to 5 minutes to pretty soon we only needed to talk a couple of times a week. But in North Central, we are having a tighter group on the daily calls, and then we have that extended group on as available to join us on Wednesday and Fridays as well, just to make sure if there's additional topics on that we need to know on the criminal justice side, if there's any impacts to jail systems, or if they're having trouble, again, finding the right people to talk to about issues that pop up for jails, that there's a couple of opportunities for them to call in as well. So eventually, over time, we expect that these will not have to be daily, but we'll just make that call as we shore up the communication and that people know who to call for what over time.
So I just wanted to add, as you can see, there's a big preliminary over the schedule. So HCA will be hosting these calls, and they'll be sending out a calendar invite with the call-in information. And so there could be changes to what this draft calendar is.
And Crystal's working on getting us all the email addresses. So if you feel that you would really have a keen interest in participating, please let Crystal know, and she'll send me your email address, and we can get an invite out to you.
Yeah, and one other thing, so this is Crystal. Anybody can email me at any time too, and I can make sure and get it to the right person if you're having any kinds of issues, or during this next month, and then once go live happens. So we'll be sure and take care of problems. There was a question in the chat box that said, if the BHO is shut down 12/29, who do I report crisis services to for 12/30 and 12/31? Beacon starts 1/1/18. Does Beacon or the BHO or HCA have any answer for that?
Is Tamara still on the phone? I would assume that everything up until the 31st still has to get reported back to the BHO.
That's correct. Sorry, I was having a hard time with my phone.
Okay. Okay, so everything gets reported to the BHO through 12/31, and you guys will be shut down, but you'll still have a few staff that will be working beyond 12/31, right?
Correct. Yep.
Does that answer your question, Darla?
Yes.
Perfect. Are there any other questions about the early warning system? And again, let me know if you feel like you want to be part of those calls if I haven't already reached out to you. Okay. So next up we have the Consumer Engagement Work Group final update. Deb Miller, are you on the line?
I am.
Perfect.
So go ahead to the next slide, please.
Right.
Awesome. Okay, so our update is, this slide is showing a half sheet that we created, basically telling consumers kind of just the high-level changes that are coming that they can expect. We have them printed in English, I believe Spanish, is that correct, Crystal? I just haven't gotten the Spanish ones yet.
Correct. We have English and Spanish
printed. Okay, printed, and then they're available in Russian and Ukrainian. This one, as well as the next one on the PowerPoint presentation, which is for providers, these have been emailed to a large network of people in Chelan, Douglas, and Grant counties. We used interagency listservs in both Chelan, Douglas, and Grant, as well as mental health stakeholders. Listserv got all of the information. So we've pretty broadly via email disseminated this information. We do have some hard printed copies. I've got some in my office. I believe Crystal has some in hers. I can't remember if there's still some left at the BHO or if I took all of them. But they are available. If anybody did not get them and need access to them, let either Crystal or myself know and we can forward them to you guys to print. Go ahead to the next slide. And this is the two-pager. It's a full sheet. It's printed on two sides, and it's basically the talking points to help providers and frontline staff answer questions that people may have about the upcoming changes. I'm really excited about this. I think my staff was some of the staff that just asked for some scripted details, so they make sure that they tell their clients the right thing. So those are also available printed in English, and I have probably still half of a box still in my office, plus they're available electronically for everyone. Next slide talks about a PowerPoint presentation that Healthcare Authority is still working on, and as soon as it's finalized, we can send it out to the distribution list. So provider offices can use it as a standard training, if you will, just kind of a standard information about the changes so their staff is prepared to answer any questions that are necessary. Next is radio PSAs. We will be running those in December in both English and Spanish. I believe that Alejandra actually made a couple grammar corrections on the Spanish message yesterday, but those will be going out to the stations. And then some additional efforts that we're working on, but they're not quite available yet, are Facebook posts. I know Healthcare Authority and many other state agencies often not advertise, but post things on their Facebook page. So what we will do is once Healthcare Authority has created that Facebook post talking about the changes here, we can share the link to that. So partner organizations that have an active Facebook presence in our communities can actually share that on their page and get the information across that way. I'm actually excited about that. It's a good way for all of us to cross-communicate messages, I believe. And then the news release will be created by Healthcare Authority and released in mid-December. And the communication work group actually created the list of places where that news release can be shared. So I'm not sure that there's any other update I have. The one thing that crossed my mind that I just want to throw out there, and maybe in particular to Melina, is the one confusion that I consistently hear has nothing to do with Apple Health, It has everything to do with Molina pulling out of the QHP, the Qualified Health Plan, and that's confusing to providers. I've actually had some of my staff say, well, wait a minute, Molina's not going to be here after January, and I find myself oftentimes explaining that that's the QHP and that's very different than Apple Health. So I just wanted to put that message out there to our Molina partners. I don't know, that's the only MCO that I've heard that about. So just an FYI. And then the other thing that I will say is several agencies here in the Chelan-Douglas area partnered on an open enrollment event that's going to happen tomorrow at PIBUS from 4 to 7. And while the target population is more the Qualified Health Plan folks, I am assuming that we will still have some Apple Health folks. So we'll make sure that we have the information available at the table. But if, I realize this is probably last minute, but if some of the providers on this call weren't aware of that, that is an opportunity to come. Last year we did the same event, and there were quite a few community people, health consumers that came to that event. So, feel free to join us and answer questions of consumers. And so, Donnie, I think I see you're on the line. I think maybe it would be good for you to be prepared with that little nugget of information of the confusion between QHPs and Apple Health for Molina moving forward. Crystal, did I miss anything?
I don't think so. You did a great job. I just wanted to, there's a slide in here for a thank you to the consumer engagement work group. There's been a lot of work that's gone into this work group, and I think a lot of good things have come out of it, and I'm excited about that. So thank you to Deb for doing the update, and for all the people that have participated in the meetings, and HCA for helping us come up with these communication materials. So I really appreciate it.
Not that there's been a lot of questions. Yeah, but if there's questions, we're happy to answer.
Yeah. Anybody have questions? And let me know if you would like digital copies of either of those handouts or hard copies. They are also available on the DocVault, www.mydocvault.us. So the last item we have on our agenda is for an update from HCA on the client transitional plans and assigning the MCOs from Isabel and Alice.
Hi, this is Alice. So first we thought Jason Bergman could just walk through the timeline with a little bit more detail in terms of when clients got or should expect to have more information about their assignments and enrollment changes. So Jason, do you want to take it away?
Yeah, hi everyone. This is Jason Bergman, and I have a little bit of a timeline here for you. It kind of goes back. I'll just start from the beginning. When we started was 9/1, a postcard went out to every head of household. 10/1, a disenrollment letter went out to every client letting them know the BHO is leaving and they'll be in an integrated managed care plan or a BHSO. And that's the last that has gone out. Recently, the most recent thing is we've updated our IVR system. So now when people call into our call center, it'll have updated information. So that's good. And the cutoff for December 1 is today. So if anyone wanted to call in and do that, they can. And then they don't have to worry about anything in December. They just transition to their new plan. Cutoff for January 1st is going to be 12/28. So that's the last day people could call into our call center and get a January 1st enrollment. So those are the two cutoffs. And then in December, well, right before December on 11/29, I think someone mentioned there's a social media post we're sending out. That's just going to say on Facebook and Twitter and I'm not sure what all else, but basically whatever we have social media accounts for. It'll say Chelan-Douglas and Grant counties, watch your mail for changes coming to Apple Health Managed Care in your county. And then it has a link to that half-page thing we saw earlier, the 190005 document. So again, that was November 29th. And then December 13th, we'll have a very similar one. It'll say Chelan, Douglas, and Grant counties. You should have received your welcome to You should have received your welcome to Apple Health booklet. Any questions? Want to change your plan? Contact us by December 27th. And we put the 27th on there because we usually tell folks 2 days prior to that actual cutoff, so they don't call at the last minute. And then that has, again, a link to that, well, the full notice, the 19-001 document we looked at also. And that's it for the social media that I'm aware of. I don't have anything else. We did have, I don't think there was any other questions on these. Did anyone else have any questions on the communications that we're sending out?
So, Crystal, we thought it would help just to remind people, if, you know, back a few slides on the one-pager, our 1-800 number was printed in the lower right corner of that. So there's a how to contact us. And the phone number, oh, I guess it's a little obscured on the slide. So sorry, but these documents are up at the MyDoc Vault site, and so you can. So the one that has the little apple on the front of the page has our phone number, 1-800-562-3022. And that's the best way if you have clients who are just wanting to know if they, you know, missed the mail or the mail went to the wrong address or whatever, and they want to know what plan we assigned them to for January. The client can call that number, and if it's, you know, if that was not what they had wanted, they can change it right on the spot. If providers want to call to similarly get that information, they can also use that 1-800 number to call and get information about what the January 1st enrollment looks like. But of course, it's a snapshot in time because, as Jason just said, people can keep changing their enrollment up until the end of the month. And so it's not a guarantee that the person will have stuck with that plan once they switch or once we had assigned them. So, so the best thing is for you know, just speaking directly with clients. We are working with the BHO directly to get information about clients who have open authorizations. Related to that is that in order for us to share with the health plans who is authorized for treatment, on the SUD side, the client must have signed a release of information. And so we have reached out directly to the behavioral health providers who do SUD treatment to send us lists of clients who have those signed releases of information. If you need to reach out directly to us to get more information about that, Crystal can get you connected to us. I think those are the main points we wanted to make sure that everybody had. I don't know, Isabel, if there's anything else you wanted to add on that.
Nope, thank you.
This is Jason again. I remembered the one other question that someone had that I didn't put on my timeline because it's not really communications per se, but there's been questions about what do we mail clients in December? And there is a letter that goes out, and we mentioned that in these social media posts. What that consists of is the Welcome to Apple Health booklet and an enrollment notification that goes out to every new Apple Health client. And what we're doing is treating every client as a new Apple Health client because they have a new IMC plan. That's the mailing that's going to go out. So if anyone's asking about, you know, what's the letter in December, that's just a standard provider one enrollment letter. And I think a copy has gotten to Crystal. But we have a couple that have been blessed by our leadership because they're not real letters, they're templates for letters because there's different optional text, so it's kind of confusing and it's not something that we want to be sharing with a lot of stakeholders. But it's not something, the other important thing is it's not going to be going out like on one specific date. This goes out as clients get enrolled, so that's why it's not really on my timeline. It's a standard thing that all clients get statewide. It just happens to be everyone in North Central at once also. So they'll all be getting those through December up until, I want to say mid-December, however long it takes us to enroll everyone.
Alice, do you have the 1-800 number available just so we can say what it is here, and I can send it out in an email as well.
The 1-800 number is 1-800-562-3022.
Perfect. Thank you.
Mm-hmm.
And then at the bottom of the screen, you can see that we are already thinking about the Okanagan transition for next year. And we just wanted to let everybody know that Isabel Jones and Jessica Diaz, who have been working with us this year, will continue to be our points of contact with HCA next year. So that's really great that we're going to be able to continue to work with them. So that was everything that's on the agenda for today. I just want to give people that are on the line an opportunity to ask any questions of anybody that presented or throw anything out there that's on their mind before we close. All right, well, if nobody has any comments, we'll go ahead and end early. Thank you again to everybody that's been a part of the advisory committee. And as I said, this is our last planned meeting. If you have any questions or issues that you want to talk to me about, I'm always available, so go ahead and email me. So thank you, everybody. Have a great day. Have a great day.
Thank you.
Bye.
Thanks, Crystal.